Welcome back to the Seymour Show. What if cholesterol isn't the villain? Now, before we get to cholesterol, I want to add something about marijuana, which I spoke about in our last episode. Soon after I recorded that episode, the New York Times came out with an editorial review of marijuana and changed their stance on it. So even mainstream outlets that once supported legalization are now sounding the alarm. The New York Times editorial board, which backed legalization more than a decade ago, had admitted that the broader acceptance of marijuana use has led to worse outcomes than anticipated. They point to increased daily use, mental health concerns like cannabinoid hyperemesis and psychosis, and also misleading medical claims from dispensaries. Instead of rolling back legalization, they now argue for stronger federal regulation, including limits on THC potency and cracking down on false health claims. So there you have it. More and more people and organizations are coming out against marijuana, and it's time that the government cracks down on it. All right, back to cholesterol. Cholesterol has become one of the most feared words in modern medicine. For decades, we've been told that high cholesterol, especially LDL, is the primary driver of heart disease, and that lower it at almost any cost is inherently good. That narrative is incomplete. Cholesterol is not a toxin, it is essential for life. Your body uses cholesterol to build cell membranes, produce steroid hormones, create bile acids for digestion, and support brain and nerve function. If cholesterol were inherently harmful, human life would not function. What matters is context. A study published in the European Journal of Cardiovascular Medicine examined how metabolites produced by gut bacteria may be the boogeyman and not cholesterol. According to the study, cholesterol does not randomly stick to healthy blood vessels. Plaque formation occurs when blood vessels are damaged, and that damage is driven primarily by inflammation. When inflammation injures the endothelium, cholesterol becomes part of the repair process. Over time, repeated injury leads to plaque buildup. In other words, cholesterol is often a responder, not the root cause. This helps explain why multiple studies, particularly in older adults, have shown that higher LDL levels are not consistently associated with higher mortality, and in some cases are linked with greater longevity. It also explains why newer research is shifting focus away from cholesterol alone and towards chronic inflammation, like C-reactive protein in metabolic health, also looking at gut microbiome composition. In fact, in September of 2025, the American College of Cardiovascular or American College of Cardiology published a new recommendation for universal screening of C-reactive protein levels in all patients, along with continued measuring of cholesterol levels. So, heart disease is not a single variable problem. Reducing everything to lower LDL at all costs may oversimplify a much more complex biological system, and that oversimplification can lead to misguided treatment priorities. If inflammation is the real driver of vascular damage, then lowering inflammation should be the primary goal, not just chasing cholesterol numbers. That starts with metabolic health. Diets high in refined carbohydrates and ultra-processed foods promote chronic inflammation, while whole food patterns, particularly those rich in fiber, healthy fats, and adequate protein, tend to lower inflammatory markers. Excess visceral fat itself is inflammatory, which is why insulin resistance matters more than LDL alone. Physical activity plays a direct anti-inflammatory role. Regular movement improves endothelial function, lowers C-reactive protein, and reduces oxidative stress, even without major weight loss. Sleep and stress are often ignored, but critical. Poor sleep and chronic stress elevate cortisol and inflammatory cytokines, directly contributing to vascular injury. There's also growing interest in the gut microbiome. Certain gut bacteria produce inflammatory metabolites, while others are protective. Diets rich in fiber, fermented foods, and reduced processed sugars support a healthier microbial balance. Finally, inflammation should be measured, not assumed. Markers like C-reactive protein provide far more actionable information than cholesterol numbers alone and help identify who is actually at risk. The goal isn't to ignore cholesterol, it's to understand its role in a much larger inflammatory process and treat the root cause rather than the byproduct. Now, if this episode helped clarify some issues, share it, not to provoke outrage, but to encourage discernment. And please subscribe to get notified of new episodes. This is The Seymour Show. Stay grounded in truth.